So good afternoon, sir. So today I am going to do the neurological assessment part 1. So ma'am, good afternoon. My name is Johnny Sadalguno. I am your student nurse for today. So may I know your name?
Yin.
So today I will assessing your neurological assessment. So first I will assemble all equipments and supplies needed to the procedure, and I will explain to the procedure to the client, and I already wash my hands. So first is I will position the client in a sitting position, um, sitting position beside the examination table. Then I will take the vital signs of patient, the blood pressure, temperature, respiratory rate, and pulse rate. So, in starting the procedure, I will position the patient in a sitting position, and the client must be sitting in the examination table or as in the appropriate position. I will get the vital sign of the patient. So, So after I check the vital sign of patient, I will now do the mental status assessment. So I will note for the general appearance, hygiene, and facial expressions, body posture, and motor activity. So, ma'am, can you start and walk? Okay. This is, okay. So, do you feel any pain?
No.
So, after I note for the general appearance of patient, I will assess for the degree of wakefulness or alertness from full alertness level 1 down to coma level 4. So, I will perform a glass coma scale and I will note for the eye opening, motor response, verbal response, and using an appropriate scoring in ROM, in Glasgow coma. So, ma'am, do you know what is the date today?
June 5, 2020.
So can I ask where do you live?
Australia.
So what is my name?
Isabel.
So after I perform the Glasgow coma scaling, the score of patient is 15. She has the normal eye opening, motor response, verbal response. So next is I will assess for her memory. I will ask her to repeat the 3 words that I immediately to measure the immediate recall. So, ma'am, can you repeat after me the love, light, loss?
Love, life, love.
Then I will ask the patient to the events that occur minutes or few months to measure the recent call. So, ma'am, can I ask, ano din taon mo, Arlina?
Red velvet.
Then, for the remote memory, I will ask events in remote past or historical events that may be answered by general population. So, ma'am, do you know what is the nickname of Jose Rizal?
Pepe.
So, next is I will assess for the mood and affect and its appropriateness. So, ma'am, can I know what is your mood today?
I'm hungry.
And
Tired.
then I will assess thought content and I will assess for the intellectual capacity, fund of knowledge, and calculation ability. So, ma'am, can you ask how much is 5 times 5?
25.
10 plus 5.
15.
30 plus 30.
16.
So next, I will assess for thought content as to interpret proverbs, insight, as to interpret situation to assess judgment. So for insight, ma'am, how you interpret time is gold.
Time is gold because our actions are defined by time, and simple change in time can alter our future and future circumstances.
So for in assessing for judgment, what will you do if you found 100 pesos in the street?
First, I will ask if there is a nearby CCTV, and ask the owner if I could see it, so I could see who lost the 100 bill. If not, I will keep it.
So, in mental status assessment, assess language and comprehension. So, ma'am, what language do you speak?
I can speak Tagalog and English.
For comprehension, what is the purpose of chair?
The purpose of a chair is basically common sense. People use it to sit down when they're feeling tired.
So, next is I will testing for the cranial nerves of the patient. So, first, I will checking the CN1 or the olfactory, I will instruct the client to close eyes, test one nostril at a time with the opposite side occluded using 3 materials such as soap, coffee, and toothpaste. So, ma'am, tell me if it is coffee, soap, or toothpaste.
Coffee. Soap. Toothpaste. Toothpaste. Coffee. Coffee. Soap. Soap.
So, the patient able to identify the smell of the coffee, soap, and toothpaste.
Kakao.
So next is I'll be testing the CN2 or the optic. I will assess for visual fields by confrontation using a Snellen chart or a newsprint to measure visual capacity. So ma'am, can you read this?
Consent form for system assessment. The main objective of the system assessment presentation is for the students to apply the knowledge and techniques learned in the classroom to actual presentation.
So the patient able to read or identify the
What's written?
what's written in the print in the newsprint. So next is I will assess for the extraocular movement. I will instruct the client to follow examiner's finger as it moves horizontally and vertically or making cross and diagonally making an X. Then I will note for conjugate eye movement, diplopia, and nystagmus. So next is I will assess for convergence and accommodation. I will have the patient focus on the examiner's fingers as it moves toward the patient's nose. For convergence, turning of eyes inwards, and for accommodation, the pupils constricting with near vision, and I will check for the ptosis or drooping of eyelids. So, ma'am. So next is the CN5 or the trigeminal sensation. I will use a cotton ball for light touch and a blunt object for deep touch. I will instruct the client to close eyes. Then I will touch each of 3 areas with the object in random fashion on each side of the face. Then I will instruct to say touch if the client feels the sensation. So, kung i-touch, takas ang ayon baka deep, then ari light. Close eyes.
Light. Deep. Light. Deep. Deep. Light. 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 Deep.
So next is for motor 1, I will ask the patient to clench teeth. Then I will palpate the masseter muscle just above the mandibular angle. So, clench teeth. So next is I will check for the CN7 or facial. So I will inspect the face, noting any facial asymmetry including the drooping, sagging, or smoothing of normal facial creases. So I will ask the client to raise eyebrows. So ma'am, raise your eyebrows. Close your eyes. Purse the lips, purse your lips. Draw back the corners of the mouth in an exaggerated smile. Frown. Puff out your both cheek. So next is the CM8 or the vestibulocochlear. I will test for the grossly and the cochlear part of by having the client to close her eyes and indicate when a ticking watch or the rustling of the fingertips of the examiner is heard as the stimulus and it brought closer to the ear. Then I will perform the Romberg's test for balance. So, ang balance ko, ano ang kung vortex. Kawan. For the Romberg's test for balance, ma'am, close your eyes. Then, yung imo, balance. For 30 seconds. Okay. So next is the cranial 9 or the glossopharyngeal and the cranial 10 vagus. So I will perform the gag reflex test by touching the pharynx with the tongue depressor on both the left and afterwards on the right side. Then I will observe the normal gag or cough, bilateral contraction or palatal muscles. Then I will have the client to phonate the word "a", noting the bilateral symmetry of elevation of soft palate. Then I will likely hold the client's throat on either side, and I will ask the patient to swallow. Then note for symmetry. Swallow. So now I will use this tongue to touch. So, ah,
How? How? How?
So next is I will check for the CN11 or the spinal accessory. I will ask the patient to shrug the shoulders against resistance, then turn the head against resistance. And I will note for the smooth contraction of sternocleidomastoid and the trapezoid muscle and the symmetry, atrophy, and the fasciculations. So ma'am, head. Okay. Then shrug your shoulder. So the last part in Neuro 1 is the CN12, the hypoglossal. I will ask the client to protrude tongue, and the tongue should protrude relatively straight, then minimal degrees of deviation. Then affecting only the tip are insignificant. So I am done now with the Neuro Part 1. So the patient has a normal finding and able to do the test and some activities in the cranial nerves. Thank you.